Well, the ambulance service means to me safety, response for people that are in need of emergency medical care.
My parents were transported with the ambulance. Thankfully, my children have never been.
Ambulances in emergency rooms are often taken for granted, and I did the same until one morning I went to the job and a grinding wheel on my grinder flew apart and cut my wrist.
In 1970, the Arcadia Ambulance Service was created to fill a void in emergency medical transport. A partnership between the City of Arcadia, Township of Arcadia, and Township of Glencoe offered emergent care to the region. And since that time, new partners, including the City of Independence and the townships of Burnside, Dodge, Montana, and Wamandee, have been added to the system of emergency care. The Arcadia Ambulance Service is committed to being a leader in emergency medical services and to providing our community with excellence in pre-hospital and out-of-hospital care. By valuing our staff, patients, and clients, maintaining and promoting the highest standards of our profession, supporting illness and accident prevention, managing resources effectively, and working collaboratively with our colleagues in healthcare and emergency services. Arcadia Ambulance Service is truly a community-based service with administrative and financial decisions made locally by board members representing each municipality and township. Arcadia Ambulance Service provides advanced emergency medical technician level care to an area greater than 450 square miles and a population of nearly 8,000 people. That means responding to medical emergencies, transporting patients to medical facilities, or even air ambulance transfer, all happening 24 hours a day in any weather. This is all done in an efficient and timely manner. Arcadia Ambulance Service average response times from when the EMTs leave the garage to arrival on site is only 8 minutes. Average transport time to the nearest medical facility is just 15 minutes. Arcadia Ambulance Service has a staff of just one full-time EMT and a half-time EMT and 21 paid volunteers from the surrounding area. This team provides staffing for the community 24 hours a day, 7 days a week. In addition to immediate medical emergencies, Arcadia Ambulance Service provides even more to the community, including on-site medical presence for high school sporting events, large corporate functions, and community events. In addition, Arcadia Ambulance Service provides ongoing CPR training classes for emergency personnel, educators, students, and even with area businesses.
The ambulance service complements us because I think we work as a team very well together. On medical calls, car crashes, even at structure fires, they're there for us just in case we need them. They respond automatically.
Currently, Arcadia Ambulance Service has a rolling 60-day lease for space on the Arcadia campus of the Mayo Health System. This consists of land for the ambulance garage, office, supply storeroom, and 3 on-call EMT sleeping rooms, which are only available for volunteers from outside the city of Arcadia to use. The climate-controlled garage houses 3 ambulances and lockers for limited equipment storage. Office space houses day-to-day coordination and chart dictation areas, but also doubles as supply storage for the medical response service. In addition, staff members have a small central break room that they can utilize. However, since the closing of the hospital and nursing home in Arcadia, an air of uncertainty has surrounded the future of the Arcadia Ambulance Service operations and facility. And here's why. Arcadia Ambulance Service has a 60-day rolling lease, and that means that at any time the ambulance service could be asked to vacate offices at the end of that 60-day period.
If the lease were to be canceled, say tomorrow, we would maintain our ambulances in the ambulance garage, which we have now, but we would have to do a quick search and find housing for our personnel that stay at the facility, because we need to have a place for our people on call to stay, and also we need room to hold our supplies and other equipment, because the ambulance garage we have isn't big enough to hold all that equipment.
Unfortunately, the closing of the Arcadia Hospital also means longer transports between emergency locations and medical facilities.
Well, I think it's important for us to look at advancing to a higher level service, in particular a paramedic level service, and that and that relates back to the hospital closing. We transport patients for longer amounts of time. We're in the back of the ambulance for 15, perhaps maybe even 30 minutes. And we could be caring for that patient, or should be caring for that patient, the entire time. And a paramedic level service would allow us to enhance our assessments, would allow us to provide them with additional medications, enhance the skill level that we're able to provide for that patient. Again, so we can care for that patient while we're en route to definitive care.
In order to upgrade to a paramedic service, the Arcadia Ambulance Service has got to meet with folks from the municipalities and basically promote the service to them. Of course, there's a dollar figure involved, so it would take more tax dollars. So it's got to be approved by each municipality in order for us to go ahead with the paramedic service.
How is Arcadia Ambulance Service funded? Well, funding is actually a combination of service fees, taxes, state education grants, and community donations. This funding is used to help offset the cost of insurance, medical supplies, utilities, rent, salaries, and ambulance maintenance.
I don't have an answer to funding, but just remember, when it hits you, it's important. And when it's the other guy, it's not so important. But think of your loved ones. When they need help, will we have someone there to help you? Or will we have to call La Crosse, Eau Claire, any other community to come to help you? We need to think of that.
The Arcadia Ambulance Service strives to meet the changing needs of the community for pre-hospital and out-of-hospital care, and believes that by the timely application of the advances of both the art and science of medicine to the practice of emergency medical services, we can decrease suffering, improve the health of the community, and save lives. Arcadia Ambulance Service, a community resource serving your neighbors, friends, and families for more than 40 years.
The community needs to rally around this and support the emergency services program that Arcadia has and make sure that it stays here. We already lost a hospital, and that was huge. An emergency room is huge. To lose that, and I can't see us losing our ambulance service. That would be just devastating to the area.
Even if you live out 15, 20 miles, you may need that ambulance one day. At that time, you realize how important the ambulance is.